starting. Okay, thank you. Starting with the Measure X update from Mariana, we are going to have an update from our health services. And then the third segment is discussions around tenant protection. And finally, we're going to learn more about energy insecurity. So a lot of information. Stay with us, stay engaged, ask your questions in the chat box, and I'll be monitoring them and I'll be asking some follow-up questions if we have time. So Mariana, are you ready?
I am ready. Excuse me. Good morning and welcome, everyone. If you've been coming to these meetings for a while, you have seen some version of a Measure X presentation in the past. It's a process that's been going on for, depending on how you count the start, for several years now. And I'm always happy to come back and share updates and what I know. I noticed that Michelle Stewart, who's the new Measure X Community Advisory Board Vice Chair, is here. So just want to welcome and honor you, Michelle, as co-leader of the advisory board. Okay, let's go to the next slide. And I'm going to look at my time because I've got to pack a lot into a little time. Okay. So again, if you're new to Measure X, just a quick overview. It's a half-cent sales tax. It's countywide. It's for 20 years. It was approved by voters, probably many of you, I'm hoping, and thank you, in November of 2020. The revenue is around $100 million annually. It varies because sales taxes vary in good and bad economic times. The current fiscal year, or the just ended fiscal year, the projection had been $127 million. So it's a good chunk of money, which is the good thing. The implementation timeline, so the advisory board, of which I and Michelle are members, was appointed March of last year. On April 1st of last year, the money started being collected. And then last summer, there were weekly presentations to the Measure X Community Advisory Board, which is what that MXCAB acronym means. On each area of need, you'll see a list of those presentations in a minute. And then on July 1st of last year, the county received their first chunk of Measure X funding. In November of last year, after that summer of presentations and planning, the advisory board delivered their first round of funding recommendations to the Board of Supervisors. The advisory board is an advisory body, as the name implies, and so it's up to the Board of Supervisors to make the final funding decisions, which they did in late last year, early this year, in a couple of rounds. So just to kind of ground us in the process. So this is a list. I'm absolutely not going to read this, and you can look at the slides later. As Susan said, they will share them out. But just to give you a quick sense, you may know many of these folks that are really, we have a great group of folks from all over the county. Some are board appointed by individual board members. Some, like myself, are at-large members. So a lot of thought went into both the structure of the advisory board, and then the supervisors did a great job of interviewing and appointing folks to it. Next slide. And then this is the schedule of presentations that were made in a very intensive weekly process throughout last summer. Again, just to give you a sense of the types of issues and community needs that we delved into. And for each of these issues, we put together a panel of speakers that included impacted residents, community-based service providers, and county providers within the various county departments. We tried to get a variety of views and life experiences, et cetera, into each of these explorations and discovery process. Next slide. So we also, along with organizing all those mutual learning sessions, the group also developed a vision statement. Spent time on this to really ground our work in what we care about and what our community needs and wants. And so it's our vision is that our county has the necessary funds to invest in and sustain a robust system of prevention and care, and the services necessary to support a vibrant community, and that all residents have equitable opportunities to thrive. And that vision drove and continues to drive how we do our work and our sort of North Star of where we want to drive our bus toward all together with all of you. Next slide. And then we also developed operating principles, which were more day-to-day, again, how we do our work together and how we hold each other accountable, and how do we reflect out loud in our activities and how we do our work, the values that we care about. So you'll see here the core values of equity, justice, inclusion, and compassion, the importance of prevention, being resident-centered, naming inequities and disparities, and creating a culture of inclusion, welcoming, and belonging. And we manifested that through having translation and interpretation services in both ASL and Spanish for each of our meetings, which we continue to do. So there's many ways that we really work to kind of walk our walk on these operating principles. Next slide. So I'm going to like blast through, and you'll may want to go back later and look at this. Some of you may have seen this in previous iterations. So we, the advisory board, organized our recommendations after all of those learning sessions and subsequent discussion, further input by the public and by the county and by community providers. We sort of came up with our dream list and prioritize it, which was necessary but painful. And then we organized our recommendations into the 5 goal areas that you see here. And what I'm going to do now is kind of fairly quickly walk you through each of these 5 goal areas. And then beneath or within each of these areas, there's a list of specific programs or initiatives that the Measure X Advisory Board recommended. And then whether the Board of Supervisors chose to fund each of those when they had their deliberations and made their decisions in December and January. So just want to give you an orientation of what you're about to see, because it's a lot of data. Okay, so the first goal area and the way we organized this first chunk is mental well-being. And we have sort of a goal statement here. Next slide. So these are the recommended strategies, and I'm not quite going to go through each one, but I'll touch on some on each slide. So a lot of this, you'll see a theme throughout this. We really focused on community-based services. And so the first one here is community-based mental health, while also recognizing that there's a really important role for the county in providing core sort of public services. So it's really, we envision a partnership that is equally strong in community-based and county-provided services. And so you see here, there's some community-based, some county-based, and all 3 of these were funded. Next slide. Continuing goal area 1, mental well-being. There's several here that are not funded or not yet funded in this first round. Substance abuse treatment, API, mental health services, services for LGBTQ folks. So kind of drilling down into some specific populations and communities that told us we need more help. And so some of these were not funded, and the San Ramon Valley Fire Model of Mental Health Crisis was funded. So, you know, a variety of decisions by the Board of Supervisors as they made their difficult choices on what to invest in and how to invest. The second goal area of 5 is what we call equity in action. So a community that prioritizes equity and removes structural barriers that cause inequities and poverty. Next slide. So here are recommended strategies. So one that was funded, and we're very grateful, is the planning process, or the actual Office of Racial Equity and Social Justice. The planning process is philanthropy funded. And then once the office is stood up in the next several months, then the county has funded kind of a core budget out of Measure X dollars, which is great. And there were a couple of other proposals that came from the community to the Measure X Advisory Board that were not funded, including a East County Community-Based Equity Center based on a presentation by the county's Contra Costa County Racial Justice Coalition. And then there was legal representation for immigrant residents via Stand Together Contra Costa. This has not yet been funded, but actually that program and the funding of it through several means is being discussed currently by the board and various board committees. And so that process is still alive, just FYI. Next slide. Then a number of things here, community schools-based arts programs, wasn't funded, immigration-based legal services, and then a couple were some arts and culture commission programs, and the creation of an innovation fund. And so just to note that many of these programs are continuing or expanding, especially county-funded services, and then some, like the innovation fund, are brand new and pretty innovative and exciting. Next slide. Goal area 3, healthy communities. So this we put in healthcare, housing, childcare, just all those sort of essentials of living and being able to thrive and, stabilize one's own and one's family life. Next slide. So the recommended strategies here. So healthcare for remaining uninsured residents. So Contra Casa Cares, many of you are familiar with that was funded, which is exciting. And then a local housing trust fund, that's another example of an innovative and new program. There's actually a hearing next week, which one of our other speakers is going to talk about in a while. So that was an exciting program that we're grateful that the Board of Supervisors voted to support. And then there's some that were not funded, tenant legal services and supports, housing subsidies for youth and young adults, some community-based food distribution, et cetera. Subsidized childcare came back to the board in January and was funded at that time. And then a note at the bottom that there was a sort of separate track of health department capital projects with quite a large dollar tag that sort of came directly to the board rather than through the advisory, the Measure X advisory board. And that request was funded last December. Okay, next slide. Okay, fourth and fifth goal areas. Hope you're hanging in there. So we strive to be a community that intentionally strengthens and provides support for all residents and for family members of all generations. Next slide. So the strategies here, there's services for children with disabilities, transportation planning, youth centers in both Central and East County. That's another new and innovative program or initiative that has been funded, and community-based aging services. So all of these on this slide were funded. And then there was a mix here of things that were and were not funded. There's a lot of interest in the county around a guaranteed income pilot, and a planning group is working on that. The board did not choose to put Measure X funding into that at this time. You can see just sort of a number of other things here and what was or wasn't funded. Next slide. And the last and fifth area is creating a welcoming and safe community. Next slide. So there's some fire station stuff in this bucket, and then some public defender reentry support, things that were not funded. Next slide. And then, I don't know why the font is so small, sorry. And then just a kind of mixed bag here of employment services, rental assistance, abuse prevention and support, fire staffing, et cetera, most of which were not funded at this time. And then this is a link. So when you get the presentation, if it's set in a slide format, you can click on this. I would recommend it. At the June of this year advisory board, the Measure X Community Advisory Board meeting. And by the way, we meet monthly, and you can go into the board agenda center and sign up to get the agendas. I would love to see you all at the meetings. We've had really good participation during the whole allocation process, and we've had a little bit less participation since then for understandable reasons. And I'll talk about the implementation process. But meanwhile, if you click on this link, it takes you to a spreadsheet that the county administrator's office created at the request of the advisory board. And it's like a one-page spreadsheet that lists all of those programs I just went through at rapid speed there. It lists each program, what department of the county is sort of overseeing that program or initiative, what the funding is either one time or ongoing. I think there's something else on there. We're working with the administrator's office to add additional information to increase public information and knowledge and transparency. So for example, we'd love to put in the if there's going to be a community process of RFPs or requests for proposals for community organizations to bid to help implement some of these programs. For an example, there's a lot of interest from the community about understanding when that is happening and how to plug into it. So we're trying to create this kind of master list of information like that, so the public can join with the advisory board and understanding and tracking and ideally engaging in some of these public processes for the implementation of the funds. And so that's what we discuss at our monthly advisory board meetings. And again, this tracking sheet will hopefully be expanded over time to include additional information like that. And we welcome your input on what else we should include. Okay, and then very last slide. So what's next? So I talked a lot quickly about the funding recommendations process. And the phase we're in now is a couple of things. One is that process that I described last summer with all the meetings and then the recommendations. Part of the advisory board budget is included a chunk of money to bring on a formal report writer or consultant to put all of the massive amounts of data and insights that we gather during that process into a document that will be available, I think, by October of this year to all of us, again, in transparency and in the spirit of sharing information, so that any one of us can understand how is that process conducted, who was involved with that process. There's a ton, I mean, if you went to any of those meetings, there's like slide decks and reports and just a tremendous amount of information. And I'm getting the sign from Susan to wrap up. I got it, Susan. And so we are also monitoring the implementation of the program implementation, and that's our next phase of work. And I'm going to stop talking and thank you for your time.
Thank you so much, Mariana, for your leadership and your work. And we will send out her slides as well as this recording after the meeting. And also you should have access to the Google Drive, which contains all of our meetings. This is our 22nd meeting. So Natalie is going to drop that Google Drive here in the chat box, so you could actually have that access. Next, we have Gilbert Salinas, our County Health Services first Chief Equity Officer. So the fact that we actually have Gilbert among us makes me feel safer. So Gilbert, are you here? So I asked Gilbert to come in and give us an update on what's going on with health services. Gilbert?
Hello, Susan and everyone else. Thank you for having me this morning. I appreciate the invitation. This morning, I'd like to spend some time giving you all an update on some of the work we've been involved with, internal strategies around equity, diversity, and inclusion at Contra Costa Health Services. You'll also be hearing later on from Dr. Ori Zavelli about monkeypox and some of the COVID-19 updates as well. For Contra Costa Health Services, what we started to work on internally within the organization is to really take a look at our own backyard and conduct some organizational assessments. So part of the plan was to conduct a robust organizational assessment. We partnered with Justice Collective, all female, all women owned, all women of owned, women of color owned business organization has been working on equity in the Bay Area for many years. So part of the work that we dived into was looking at assessing our equity, diversity, and inclusion challenges and opportunities for communication, strategy development, communication engagement, training, and capacity building. This work continues. Our contract with them is runs through November of 2022. We have made some progress on some of this work, and so I want to share with you some of that progress. We've been able to establish a baseline against which progress can be assessed over time. So we launched an equity survey the day after Martin Luther King's birthday. The survey went out to all 4,500 staff at Contra Costa Health Services. We had a 30% response rate. And with this survey response, we are able to conduct a baseline of our measures that we want to measure over time. We want to bring the Justice Collective back to conduct another survey to make sure that we are improving over time. So we've contracted with them to come back to do that. The survey that was conducted is to help us understand our staff demographics, comprehension, comfort with racial equity issues, diversity and inclusion frameworks, workplace experience, and how identities, teams, and positions influence that experience, and whether the environment is one in which everyone can thrive. As I mentioned, this report has been concluded. We received a 30% response rate, so we're happy with that. We were putting it all together for a full-on road mapping process, which is coming next. We've also facilitated listening sessions and focus groups. So during the months of March through May 2022, the Justice Collective, in partnership with Low Consulting Group and the equity team, worked on system-wide listening sessions, focus groups, and community listening sessions with internal and external stakeholders. We have received the information on those as well. So we are ready to present some of our findings in our during our next historically marginalized communities engagement unit meeting in September. So that's part of the agenda. So please join us, or we'll be discussing some of the findings from our community listening sessions. We are also working on developing our learning and development within Contra Costa. So looking at our diversity training and all trainings that around equity for the entire organization. We have hired a full-time training equity trainer. She will be starting August 8th. And so we're excited to bring her on. We'll bring her by here to introduce her. She'll be working on some of the training modules, development, and strategizing as we launch the next phase of having our internal organization. We might be tapping on some of you to help us with that training as well, to make sure that we are hitting the mark on the training that's needed for our community, everything that's culturally sensitive and appropriate, and that meets our community standards. So be on the lookout for some invitations from us on that. The next part of our process is to create a road mapping strategic plan. It includes the development of the continuation plan for long-term sustainability, equity, diversity, and inclusion work, where the goals are clearly identified. So we need to really spend some time identifying those goals and making sure that they're SMART goals that we can measure over time. So looking at goals that are specific, measurable, attainable, realistic, and timely. And once we start doing that, we're also, there's going to be a lot of strategic planning. Human resources will be involved, process development, internal and external communication strategies, and an invitation for the community to partner with us on that as well as we develop our strategic plan and partnership. Right now, what we're doing is we're working with leadership, our internal leadership, staffing, to put together a few days of road mapping, which looks like 1.5 hour sessions, 5 days of 1.5 hour sessions, where we'll be launching that work. And the goal is to finalize that within the next 2 months. Once we have that, we would have finished the entire process that we've undertaken for equity and our work with the Justice Collective. And from that, we will be following up on our strategic plans and priorities. We continue to be out in the communities, providing testing kits and testing and vaccine clinics throughout the community. We have some updates on the monkeypox that is coming from Dr. Zavelli. So I will be handing it off to him, but we do have our clinics that are designed to help support our community. If you need any support, the latest update as of this morning, that we had first five clinics last week, and out of the 5, there were 0 patients at 2 of those clinics. And so we want to continue and encourage vaccination of our younger kids and babies. So that's all I have this morning. I'll hand it off over to Ori. Thank you for allowing me this time. And we'll see you next month.
Great. Thank you so much, Gilbert. If you could drop in the chat box the contact person for historically marginalized. Ooh, you just finished right on time. Historically marginalized group, if anyone wants to join that group. Thank you. And then I think we have Dr. Ori, sorry, go for it.
Hi, thank you for having me. Sorry I'm late to the meeting, busy morning. I'm going to talk a little bit about COVID update and then a little bit about monkeypox, and I'm happy to take questions. I sadly have to leave at like 11:30 sharp. So I'll try to be fast to leave time for questions. Thank you. So go over a little bit about the pediatric vaccines, the masks, testing, treatment, and monkeypox. Next, please. You see there the graph for the case numbers. Sorry, these hospital admissions. Case numbers are, we think, maintaining at sort of a high plateau, but they're less reliable now because so many more people are doing home antigen tests, and we don't have those results being reported to us. So the best proxy that we're using for how much COVID is out there in the community is hospitalizations and wastewater testing. We're seeing a high plateau. We've been sort of around the same level for hospitalizations, between like 90 and 120 people in the hospital with COVID at any one time for about 2 to 3 months now. We're starting to see some early indications in the wastewater. Maybe it's starting to come down, but we expect it to come down slowly because people are masking less now. They're traveling more, they're intermixing more. School's about to reopen, so we expect more transmission events at that point. But you see, sorry, last thing I'll say is you can see the unvaccinated folks are still at much higher risk of being hospitalized and having bad outcomes like dying. Next slide, please. This is the death numbers by month. You can see that, you know, the July numbers aren't complete yet because you will have the death numbers take a while to roll in. We need a death certificate and a coroner report, and then we need the coroner to send that over to us. So it takes a little while. It wouldn't surprise me if the July numbers were similar, even a little bit higher than the June numbers when all is said and done. But it's not as bad as it was back in the original Omicron surge. We do have more immunity out there, people that have either been vaccinated or had the natural infection, and have, you know, more people have gotten the booster now. So on average, outcomes are a little better. And then the other thing that we have, which I'll talk about more in a second, is treatment, which can really make a difference for reducing death. Next page. So the vaccine rollout, you can see we're up to 83.3% of the community is fully vaccinated. And you can see that almost 57% have gotten a booster or an additional dose, which is great. The boosters are still helpful. We are expecting sometime in the fall, maybe around the beginning of October, boosters that are more specifically targeted towards the Omicron variant. So they may give more protection than the current boosters that we're giving now, which are still aimed at that original, 2019 Wuhan variant, which is not so much what's circulating now. So the vaccines and the boosters give some protection. They give great protection for hospitalization and severe disease and death. They're not as good as preventing infection. We're hoping this next generation of boosters will be better at that. We don't have a date for when it will roll out yet. My guess is when they roll it out, they will probably roll it out by age groups, because the older people do get more benefit just because they get a bigger hit when they get COVID, and they have less natural immunity when you're older. Next slide, please. COVID vaccines have now been authorized for kids. They do help prevent cases in kids. Kids do tend to have milder cases than adults when they get it. But we have had, I think, over 1,500 kids in the United States die of COVID. So there is a benefit to vaccinating your children. We recommend it. We know parents are often reluctant or not sure, and so we recommend that. And I think boosters now for some of the older kids are available as well. Next slide. Here you see the dose and timelines. For the youngest kids now with the Pfizer vaccine, it's a 3-dose vaccine. For the kids 5 to 11, it's 2 doses, just like for the adults. And children can get their booster 5 months after a second dose if they're over 5. Moderna remains a 2-dose vaccine even for the youngest kids, and that's a month apart. Next slide. Masks, we are no longer requiring masks, but we still strongly recommend them. There's good data that shows that they can be helpful, particularly indoor settings, particularly crowded indoor settings, concerts, talks, gatherings. You know, a high quality mask, the best is an N95 or a KN95, and the surgical mask is second best. The cloth masks do a little bit, but not that much. So if you are gonna mask, I recommend a high quality mask. And particularly in indoor settings, that's really important because outdoor, the concentration of the virus is diluted by air movement and wind and so forth. So next slide. COVID-19 tests, you can still get free testing throughout the county. You can call the 800 number or go online at the website there. You can get antigen tests delivered to your home. We're also giving out antigen tests in CCRMC clinics. At our COVID testing sites, we're giving out antigen tests. We have given them to some members of the Board of Supervisors. All of them have been offered, and some of those offices are giving them out. We have more. If you or your organization wants to help give out more home antigen tests, please contact our logistics team. We would like to get as many of those out into the community so people can test themselves if they're symptomatic. You know, and also, you know, the testing, if you have COVID, testing yourself before ending your isolation is a nice way to do that. It's more scientific than what is being recommended by the CDC right now, which is 5 days. It's really what makes the most sense if you can get enough access to tests is to sort of test yourself out of isolation. Wait until your test is negative and then end your isolation. Next one. COVID-19 treatments. Paxlovid is a really wonderful, effective treatment. It's 5 days of taking pills twice a day. It really reduces the risk of hospitalization and death. We really recommend it to people with chronic conditions, especially the elderly. It works really fast. Like when you start taking it, within a couple of days, basically you turn negative. What is happening to some people, maybe the studies say like less than 10%, but in my experience, it's more than that. Some people will get a rebound when they stop Paxlovid. So they finish their 5 days, they test negative, and then they'll get a return of some symptoms, and sometimes a return of test positivity, which means they're returning to being infectious. My sister had that. She took it, turned negative, ended the 5 days, became, you know, sniffly nose again, and tested positive. You can, you know, be contagious in that scenario again. So just something to watch out for. Still a good idea, I think, to take it because it reduces your risk of being hospitalized and dying, which is what we care about. It does have medication interactions, so you need to talk to a doctor. In our county, we're probably among the leaders in the state in making it available in a low barrier way. You can call our advice nurse, regardless of your insurance or lack of insurance or what kind of insurance, and they'll put you in touch with a telephone doctor. They'll go over your medicines with you and send a prescription for you to the pharmacy closest to you. We have given out more than 2,400 prescriptions through that system. Many more people are getting Paxlovid also through their doctor's office as well. So we think that that's a good thing and a good idea. And it is obviously better if you use it sooner, as soon as you can after infection. Some people are like, no, I feel fine, it's just a little cold, and avoid using it. But remember, with COVID, a lot of times it's the second week that's when people turn bad. So if you're at risk, I recommend starting it early just to reduce your viral load and your risk. This is how the phone number there is how you get to the Paxlovid. You can also call your own doctor. And then there's a couple of testing sites that are run by the state that are test to treat locations, meaning they'll do your test there. And right there, if you test positive, they will give you a telehealth doctor that you can call, sponsored by the state, to get your Paxlovid prescription. That's a great option in addition to the advice nurse or your own doctor. Next page. Monkeypox, switching gears. So monkeypox is a rare disease. It's been around for a long time, multiple decades. But mostly it's been in Africa. There's a couple of different types. The one that we are seeing that has jumped over to Europe and the United States is the West African variant. And luckily, it's the less serious of the variants. So it has a relatively low mortality. The other variant can have up to 10% of people who get it can die. With this one, it's less than 1% of people die. It's spread through close personal skin-to-skin contact, including sex and kissing. So there's been a lot of confusion. Is this an STD or is it not an STD? Well, it's both. It's if you have it on your arm and you touch somebody has it on their arm and you have prolonged contact with their arm, you can get it. If they have it on their genitals and you have prolonged contact with their genitals, you can get it. So it's both, really. As of now, we've had 24 either confirmed or probable cases in our county. The risk to the general public is very low outside of certain risks that increase the chance of exposure. We have had no one die in the United States yet of monkeypox. It tends to, when you get it, you tend to develop this rash within 2 weeks of getting it, and then it lasts 2 to 4 weeks. It can be painful, and it can lead to scarring, but this is not killing people in the United States as of now. It's not transmitted via an airborne route that we have seen. The other variant was back decades ago, but this one is not. It's really through skin-to-skin contact. Next slide. The symptoms, oh yeah, I went over this. It can be similar to a flu, but not everyone has that flu-like symptom, but you can have a fever and headache and fatigue and some swollen lymph nodes, then the rash and the sores. They can look similar to herpes sores. They can also look like pox, which means you can Google these, pictures of monkeypox and see what it looks like. But if you've had a kid, there's a pox virus called molluscum that a lot of people have had a kid that had molluscum, and so it looks like little spots on your body. It can look like pustules or vesicles. Can be hard to diagnose, but not that common, luckily. Next slide. So the prevention is to avoid intimate physical contact with anyone who has symptoms, talk openly with sexual partners before intimate physical contact, practice safer sex, consider covering exposed skin in dense indoor crowds. If someone has monkeypox and you share their bedding, then you can get it from their bedding as well. So, don't share bedding with someone that you don't know if they have it or not. And stay aware if you're traveling to countries where there are outbreaks, which right now includes the US. In California, between San Francisco County and LA County, 70% of the cases are there. In the Bay Area, we've obviously had 24 cases. I think Alameda has had, close to 100 cases. So we are seeing it in other Bay Area counties. Next slide. So we have a very limited vaccine supply in Contra Costa. We are prioritizing the vaccine for people who've had close contact with a confirmed case or people who are at high risk of exposure. And if mostly that has been to date, about 98% of the cases have been in men who have sex with men. So we are mostly targeting that population while the vaccine supply is limited. And we will open it up further when we have more vaccine to open up to the general population. And if someone has been exposed or meets the current criteria, they can go to our website, which is listed right there. They can fill out a Google form and say, yes, I'm a high-risk person. Yes, I would like to be contacted for a vaccine appointment. And we will contact them as supplies allow. We've already vaccinated close to 700 people in our county, and we have plans to do a fairly similar number in the weeks to come. We're waiting for more vaccine to come through from the feds in the state. Next slide. Okay, I think that's all my slides. I can try to go to the chat and see if there's anything I missed there.
Yeah, I think we have maybe just time for one question. And then one very quick question. So one quick question was from Michelle. What's the difference between N95 and KN95? And then there's a question from Gigi. I think that's worth at least for her to share. So Gigi, do you want to first ask your question?
Yeah, I mean, we all know that generally when there's a pandemic, certain communities are harmed more than others. And since we have Gilbert Salinas here, have you guys considered prioritizing the groups that are most high at risk historically and giving them priority around that? And then you didn't share any ethnic data around the deaths and infection for our community, because I heard at a board of supervisors that you kind of closed the health equity gap for all but the African-American community as it related to COVID.
Gigi, I could jump in on I was actually typing you a long response, so thanks for asking the question. Yes, we are strategically working on placement of the vaccines and educational materials and information. Actually, the ambassadors are getting a full-on training this Thursday through around monkeypox, and so we're preparing our teams to go out and what we have learned through the COVID vaccination efforts is we've learned a lot. We've learned how to partner with communities. We've learned that our strength is with our partnership in our communities, our trusted messengers, and all of you. So we will be relying on you to help us with some of that information. And we are within our organization looking at that as well and making sure that we do have, we are creating equitable access.
And I can jump in on both that question and the KN95. So the difference between N95 and KN95 for all intents and purposes is it's not that different. It's just that KN95 the general public can buy. N95 is generally sold through vendors to healthcare facilities, but the protection is similar. The equity question, Gigi, thank you for asking it. We are totally committed in the health department to looking at equity in everything we do. And that includes COVID. I think your question was about COVID, but it also includes monkeypox. So I just will say, we don't have that many cases yet, but we are actively analyzing where they are certain ethnic or racial groups being disproportionately affected? Where should we place our clinics? How should we outreach to those groups? In Santa Clara County, their initial data showed that Latinx men were about half the cases. So we are looking to see what our numbers are. The numbers are still small, so sometimes when at the beginning stages, we don't want to jump to conclusions with really small numbers, but we're actively looking at this and targeting our vaccination efforts and prevention efforts to those communities.
Okay, thank you so much for your presentations. Now we actually have to move to our next presenters. Our next topic is tenant protection, because there are a lot of conversations and advocacy efforts going on. We have three experts on our panel. They're gonna go quickly, but they have a lot of really good information, and hopefully you're gonna stay engaged. You could stretch if you want. This is a good time to stretch. If you could get some water, but we have a lot of good information for you. So the first presenter is Betty from eBayC. Betty, are you ready?
Yes, thank you. Hi,
Yes,
good
sir.
morning, everyone. Thank you for having me all here today. My name is Betty Gabaldon, and I'm a tenant organizer with eBayC, and I'm also president of Todos Santos Tenants Union in Concord. And I'm just going to talk about real briefly about the Concord tenant protections. So after 6 long years of fighting for tenant protections, Concord renters finally have a tool to protect themselves and their children from harassment and unhealthy living conditions. The anti-harassment ordinance went into effect last week, July 28, 2022. And this applies to all residential rental units. And this victory is just an example of how all the what could happen when all the tenants, come together and fight back, right? Next slide. So according to the new ordinance, harassment is reducing and eliminating services, failure to repair in a timely manner, failure to maintain a unit as required by law, invading privacy, retaliation against tenants asking for the repairs, or failure to acknowledge or accept receipts for tenants' lawful rent payment, pressuring tenants to vacate, threatening with evictions, physical and verbal threats, and interfering with the tenant's right to form a tenants union. So now that we have this ordinance in place, we also want to make sure that this ordinance is enforced and it stops harassment, right? So we encourage all the tenants, and this applies also for all tenants, not just Concord too. But right now that Concord has this anti-harassment ordinance, to take pictures of all the problems that they have, to date the pictures, that all communications with the landlords, should be in writing, and to document everything. And the most effective tool, organize your neighbors and form a tenants union. But this is not the only harassment is not the only thing happening in Concord. Concord families are losing their homes because of skyrocketing rents and increasing eviction rates, which is contributing to more displacement and homelessness, right? Just in Concord data tenants shows that a lot of the tenants are paying 44 more for rent since 2010. And even though the state law of California limits the rent increases 10% for many properties, it's still not good. If your rent is $2,000, you still get a $200 rent increase, which is a lot right now at this point. On top of that, a lot of those vulnerable residents, especially Black and brown individuals, are currently being threatened with evictions for unjust cost, right? Many tenants are receiving 3-day notices, 60-day notices, and they get scared. They leave their house without consulting with the lawyer or with one of us organizers. So we tell the tenants to stay home and not to evict themselves. We also tell them the evictions are a process and they have to go through court for that, and only the sheriffs can remove them from the property. And this is why we're also fighting for rent stabilization and just cause evictions, because we need more tenant protections in Concord. And since May, we started a court watch program. We had witnessed that 13% of the tenants in local eviction courts have not had access of lawyers, and 80% of the landlords had been represented by an attorney, this is completely unfair. We are seeing an increase in evictions due to this and the protections, and we are still seeing a lack of access to lawyers or legal information. And this is why we need, actually, we need you. We need volunteers to come and do this court watch at the county courthouses in the county, right? So right now we're doing Pittsburgh, which is on Tuesdays and Thursdays at 9 a.m. in Martinez. Martinez Courthouse is on Wednesdays at 1:15. If you guys, if anybody wants to volunteer for that, you could message me, send me an email. I'm gonna put also the sign up sheet on the chat. So hopefully a lot of you guys, could come and join us to do this court watch. And I think that's it.
Thank you so much. That was really great information, Betty, and congratulations. Next, we have Tony Bravo from Monument Impact. He's gonna talk about what he's been working on in Antioch. Tony, are you ready?
I am.
Great.
Thank you. Good morning, everyone. My name is Tony, co-director of organizing with Monument Impact. And today I'll be talking about some of the stuff that has been moving in Antioch for the past couple of months and focused on rent stabilization, since that is the protection that is currently moving forward. But just a little bit of context, we could go on to the next slide. The Antioch Coalition is made up of a few organizations who are, I think, present here. Those consist of the East County Regional Group, ACE, obviously us, Monument Impact, and eBase. And so this coalition for the past couple of months has been organizing with tenants and advocating for tenant protections like rent stabilization, just cause for eviction, and an anti-harassment ordinance since January, so since the start of the year, because we have noticed that a lot of tenants are suffering. A lot of tenants, are dealing with harassment, are getting, eviction notices, are still waiting for their ERAP application to get approved, and are being harassed to get their rent paid. A lot of issues around habitability issues and huge rent increases that we have seen as of lately. And some of the tenants that we have been working with are from apartment complexes that are low-income tax credit housing apartments. And these consist of Casablanca Apartments, Delta Pines, and Delta View Apartments in Antioch. And so what we began noticing was that a lot of these tenants, specifically in Delta Pines and Casablanca, was that tenants received notice that their rent was going to increase by $500 to $600. So more than the 10%, as Betty mentioned in her presentation, that the state allows, but because it is a low income housing, legally, they can increase it by as much as they want. And so obviously, a lot of these tenants are, come from low income backgrounds, and so they cannot afford $500 to $600 rent increases. And so, folks have been organizing with the tenants to mobilize and demand that City Council pass rent stabilization in Antioch. And so that has been the push as of lately. Last week, City Council held a special meeting where they had a study session to discuss rent stabilization. And so, along with the Antioch Coalition, as I mentioned, the groups before, we came up with a list of demands with the tenants on what we want this rent stabilization ordinance to look like, right? And so I'll quickly go down the list of what that looks like. So number one, we want the rent stabilization yearly rent increase as a percent of the CPI amount, which is, we want it to be capped at 3%, right? And if you go really quickly into the next slide, I'll show you why it's super important that the rent be capped at 3%. As you can see, one of the things that the Antioch City Council kind of was shown as an example was an ordinance, a rent control ordinance from the city of Oxnard, which is in the Central Coast, nothing to do with the Bay Area, right? And so they're capped at 4%. And so ACE did a really good job at really showing City Council why that would not benefit Antioch tenants, right? If we can see in this chart, a 4% increase for a tenant that in 2011 was paying rent for $1,000, in 2021 would now be paying more than that, we'll be paying a little over $1,400. But if we take into account cities that have rent control here in the Bay Area, like Oakland, Berkeley, and San Francisco, it wouldn't be going up that high. And so that's why the demand, now if we can go back to the last slide, that's why we're asking and demanding that, it be capped at 3%. The other ask is obviously for tenant petitions to be heard. And this ties into with the asking for a rent board. Obviously a rent board is used to hear cases around rent increases, to ask for decreases of rent when services are not being provided, when habitability issues are not being addressed. And so that's why these items are so important for the Antioch rent stabilization ordinance. And so the rent board, we obviously want it to be people who are renters as well, who are people of color and represent the values of renters and values of the city of Antioch. If we can go into the next slide. The next one is, yeah. And so some more demands, as I mentioned before, we have been asking for these protections since January. And so we are asking that that this be retroactive, right? Since tenants are, seeing rent increases, but the conversations are starting now, and it should be retroactive to January. So that's another demand. And the other demand, obviously, as I mentioned before, is that low income house tax credit apartments be included into this rent stabilization ordinance, because they're not currently protected now. And so if we can, so that they need to definitely be included in this ordinance. And during last week's study session, City Council pretty much agreed, I think in consensus, all of them agreed that this is something that we need to move forward with. And definitely a big, thank you to council members, Monica Wilson and Tamisha Walker, who have really been spearheading and really shown true leadership to tenants in Antioch, and have really heard the concerns of community and have, pushed to get a lot of these asks to be, recognized. And so, as out of the 5 things that I mentioned, the language to include low-income housing tax credit apartments will be, language that is included in the draft. The idea of a rent board is, will happen. They just have to go over like the budget and how that they will be able to pay for that, but that will definitely happen. The retroactive rent rollback, I don't think will happen going into from January, but it seems like it might be a possibility that they do retroactive beginning in June, when the tenant protections ended. So, that is something that we continue to, we'll continue to organize and advocate for. The cap at 3%, that's something that will also be discussed and still kind of argued about, because, they didn't agree to what the percentage will be. But if we can go into the next slide, the first draft and language to this rent stabilization ordinance will be discussed on August 16th. So the invitation is for folks who work with Antioch renters, who work with Antioch tenants, who live in Antioch here. It's important that you show up, invite tenants who are experiencing high rent increases to show up on August 16th, to email the Mayor Lamar, to, approve a lot of the demands that tenants and advocates are asking for, the ones that I mentioned, so that we can, get something a strong rent stabilization ordinance in Antioch, and would be a huge victory if we are able to really accomplish a strong ordinance for this, especially for East County, and which send a really strong message to Central and other cities in East County, and will, I think, send a strong message to Concord that, hey, Antioch is protecting their tenants. By doing this, Concord, we need to do the same here. As Betty was mentioning earlier, these protections still very much needed. So the invitation is for August 16th. The time will be at 5:30. It will be a special meeting. It's in person, so if you're comfortable with going, a lot of us have been going. It's in person at City Hall, and also will be virtual via Zoom. Thank you.
Thank you. Thank you so much, Tony. I think there may be a few questions in the chat. If you could go through them and answer those questions. We do now want to move to our next presenter, Alejandra Perez Orozcos of Bay Area Legal Aid. And she's going to focus on tenant protection in Richmond, and followed by briefly Adam Poe, also from Bay Area Legal Aid, about what's happening with tenant legal services. Let's go. Are you ready?
Yes, thank you for that. Good morning and buenos dias. As Susan mentioned, I am an attorney at Bay Area Legal Aid, and I specialize in the delivery of tenant legal services. we can move on to the next slide. What I think is important to understand is that while I'm going to be focusing on specific Richmond protections, generally when we're talking about laws, I want you to consider that there are generally federal laws, state laws, and local laws, so that there are different sources of protection that could be in place at any given time. We're talking about Richmond laws today. That's actually additional to other protections that may already exist for tenants. So let's just jump in there and talk about the first one that actually is still active and in place right now. And that's a Richmond emergency ordinance that was passed back in 2020, if you'll remember what that was like. Essentially, this ordinance limits the types of evictions that can happen right now. As it's written, it basically says a tenant would be entitled to receive a written notice. And on that written notice, there are only these very limited reasons that can be the basis for that termination. So I've included them here. This is a nuisance, which is a kind of a behavior or lease violation that poses an imminent health or safety threat. This can't be someone got sick with COVID. The second one is a tenant has not paid rent as it's currently written between these two periods of time. What that is really trying to get at is non-payment of rent that's not related to COVID. And the last one is if the owner of the property intends to remove the property from the rental market, and that has to comply with some very specific rules that the Richmond Rent Board actually would enforce. Additionally, what's very interesting about this protection is that there are language requirements. Specifically, they say that a notice is required to be written in languages that agents, say a property manager, normally uses for verbal communications with the tenant, as well as the language in which the lease was originally negotiated. Really interesting to keep in mind, right? If this notice appears in a language that's different from, let's say, what you negotiated at the start of your lease, let's say it's in a different language, then that notice is not valid. Next slide, please. Additionally, and this is something I would love to call on all of you to be vigilant of, the current protection requires that this very specific language appear on all of the termination notices. And it's not just this language, it has to be bold, it has to be underlined, and it has to be in 12-point font. And I included the language here. Essentially what it does is it tells a tenant that they may have additional rights related to their failure to pay rent and other of these particular things on the notice. It also directs them to call the rent board for additional information. So I've included the exact language as it has to appear on the notice here for you. If you have a tenant, let's say you work with people that says, hey, I got this notice, you might remember, hey, if it's in Richmond, there's a requirement that this very specific language appear on it. Let's just see if that's on your notice. The reason I say that is because, as Betty pointed out, a lot of people may not have access to an attorney or speak to an attorney before deciding that they want to leave. But knowing a simple fact is this could make all the difference in them knowing that the notice that they've received is actually not valid. Next slide, please. Additionally, thanks to the work of many advocates and tenants, there's an anti-harassment ordinance in the city of Richmond, much like the one that Betty just mentioned for the city of Concord. And this one has actually been in place for a little bit longer. It took effect August 22nd of 2021, so it's almost been a year. Similarly, it applies to all rental units in Richmond, and I included some language here, where there's a rental agreement between the landlord and the tenant with some limited exemptions, like a hospital room or a room that's being rented for a treatment facility. You may wonder, okay, you said it requires a rental agreement. Many of us know that not everyone has a written rental agreement, and you're right. The interesting thing about the definition that's used in this particular ordinance is that a rental agreement can be written, it can be oral, or it can be implied. So it covers a lot more than just a written rental agreement. Generally, I didn't include a lot of things here, but it prohibits a lot of behavior by, let's say, an owner, landlord, or an agent when that behavior is in bad faith, including things like failing to perform repairs, threatening to interrupt or actually interrupting utility services, which is a huge thing we've seen for a long time, and coercing tenants to move out in a variety of ways. Interestingly enough, there's also a catch-all that sort of contemplates other behavior that may not be explicitly listed on the ordinance, which is also really interesting. Anyone who's worked with tenants likely knows that harassment can come in many shapes and forms. So that catch-all is also very important. For your reference, I hyperlinked the ordinance text here where it says ordinance, it's in blue and it's underlined. So if you want to read or check out the ordinance, it's not very long. You can just click on that once you get the slides, and it'll be something you can continue to access. Next slide, please. Lastly, it prohibits retaliation. So if a tenant raises these issues with their landlord, always recommend that they do that in writing. A landlord's prohibited from taking action against them in retaliation for them enforcing their lawful rights. How does enforcement work for these ordinances? Meaning, you know, if landlord harassment is prohibited, what do we do to make sure that it's enforced? This particular ordinance provides for civil penalties. So that's a way of saying that a tenant can sue their landlord for money. And the way that it breaks down is kind of interesting. It's an affected person, being a tenant, or the city may file a lawsuit against a particular landlord or management company for landlord harassment at the city's discretion, obviously. Additionally, an affected person, a city, or a person or entity who can represent that tenant may file a lawsuit that only seeks what's called injunctive relief, which really is just a way of saying, instead of focusing on money, we're focusing on stopping a particular behavior. So that's another option for more people to get involved with enforcement. What are we talking about in terms of liability here? The ordinance itself says that for each offense, the landlord may potentially be liable for up to 3 times actual damages, or for a minimum of $1,000 for each offense, whichever is greater. Additionally, there's a potential for attorney's fees. So for a tenant to recover attorney's fees if they prevail. And there is a provision to recover attorney's fees by a landlord or property manager if, let's say, the lawsuit was brought in bad faith, or there's like no valid claim, it was just maybe brought for improper reasons. Lastly, and also very interesting, is that there's an additional penalty of up to $5,000.
Alejandra, sorry, but we do have to wrap it up. And I think there was a question about Adam. Do you want to just pop in? Thank you, Alejandra.
Sure. Hi, I'm Adam Poe. I'm the managing attorney at Bay Area Legal Aid. I'm going to put some info in the chat about how to reach us and learn more about our services. I would just ask briefly to give a quick update on kind of the state of legal services funding. The good news is that there was a big chunk of CARES Act funding in 2020. It allowed Centro Legal, for example, to ramp up in the county. The bad news is that it's running out, and a lot of folks are working on institutionalized legal services funding going forward, and it's been challenging. And a lot of folks present today, as a matter of fact, have been working really hard on it. I will say that if anyone is interested in learning more about the state of things, and for one example, the Housing Trust Fund through Measure X that Mariana mentioned, there's a meeting next week. I'm going to put some information about it in the chat, along with some of my notes that I didn't mean to paste in there as well. In any case, the link there is to register for that meeting, be an opportunity to learn about what the county has planned, or at least some of the county departments have planned tentatively in any case, and to weigh in with your thoughts on what the best use of that funding might be. So again, my information's in the chat, and please feel free to reach out to me with more information, and I'm happy to report back as new developments occur. Thank you.
Yeah, great. So I think maybe in October we could hear back about what's happening. So now we have the best presentation we left for the last segment of our meeting today. We have Gabriela Sandoval from Turn. Gabriela, are you there?
Yes, I'm here.
There we go. Thank you. Go for it.
Yeah, thank you. Thank you for having me. So I had prepared a little bit longer presentation, but I'm going to try to cut it to about half of the time I prepared. I wanted to, during the pandemic, I had talked with the group about the shutoffs moratorium and some of the work that Turn was doing to protect folks who were incurring increasing numbers of utility debt during the pandemic. I do want to share some good news that the budget surplus, again, this year, the governor allocated funds to offset the cost of energy utility customer debt. So last year we were able to get $2 billion for debt relief. And this year we were able to secure another $1.2 billion. But I want to spend the bulk of my time highlighting a new program that has come out of the utilities. It's been in effect since February of last year. And this is really a critical program right now. As many of you probably know, even though the official utility disconnection moratorium ended last September, there's been a kind of informal and official moratorium for most of the time since then, but we are now starting to see people who are facing shutoffs because they can't pay their utility bills. So I wanted to just make sure you all know about the arrearage management plan. This is a plan that allows the forgiveness of up to $8,000 worth of utility debt. So this is for our purposes or for your purposes here. This is a program that PG&E is engaging in. There's quite a bit of eligibility requirements, so I'm going to run through them a little bit quickly here. Customers have to be enrolled in the CARE or FARA. Oh, could you go back for a second, please? Customers have to be enrolled in in either the CARE or FARA discount programs to qualify, because this is a program specifically for low-income customers. This is not a discount program. This is a program to help families get out of utility debt. And so basically what the program does is it forgives 1/12 of the customer's debt for every payment that they make on time and in full. So let's say I'm a customer who lost my job. I've incurred $1,200 worth of PG&E debt. I sign up for the arrearage management plan, which is a 12-month program, and I am able to stay on top of my current bill in full and on time every month for the next 12 months. Every month I pay my bill on time. $100 of my debt is forgiven. So after 12 months, $100 a month are forgiven. My $1,200 debt goes away completely. Next slide, please. So again, only CARE and FARA customers are eligible. Customers had to have been with the utility company for at least 6 months and had to have had at least one on-time payment in the last 2 years. The debt has to be at least $500 for PG&E customers who get both gas and electricity from PG&E. If they're only receiving gas from PG&E, so this would be more like up in the Sacramento area, not relevant to Contra Costa, but if they're only getting gas, then that debt only has to be over $250. The debt has to be at least 90 days old. Not all of it, but some portion of it has to at least be 90 days old. And even for customers who are on a payment plan, they can call up the utility company, they can call up PG&E and switch to the arrearage management plan. Next slide, please. Let me see. Oh, this is some of this I think I've already shared. So there are provisions made so that customers can stay on the plan even if they miss a payment. As long as they, so say they miss a payment in January, as long as they come back in February and pay the last month's bill as well as the current bill, they can continue on the arrearage management plan. If, however, customers do miss 2 sequential payments, so March and April, or May and June, then they are removed from the plan. But what you should know is that any debt that has been forgiven up until that point remains forgiven. So this can still be a really great tool for people to bring down their debt, even if they're unable to remain on the program for the full 12 months. Next slide, please. Customers are qualified to eligible, customers can enroll in the program after 12 months of being off of it. So say I'm unable to make my bills payments on time for 2 months in a row and I get bumped off of the arrearage management plan. I sign up for a payment plan and I try to stay up to date on my bills. And then 12 months later, I can sign back up for another arrearage management plan. And customers who maybe are, let's say I lost my job and I sign up for care and I sign up for the arrearage management plan, and 6 months in, I get a great new job and I no longer qualify for care. As a courtesy to customers, the utilities are allowing people to complete the arrearage management plan, even if they are no longer eligible for care during the 12-month plan. And again, this is a really critical program. We are really working hard to get the word out because it can forgive up to $8,000 of people's debt. And if people have more debt, and some customers with PG&E do absolutely have more than $8,000 of debt with PG&E, what can be done is the customer can enroll in AMP, they can have $8,000 of their debt forgiven, and then they can qualify for a payment plan for the remainder of their debt after the arrearage management plan has been completed. So lastly, I just want to share with you all very quickly, and I was going to share a short video. If hopefully I can share my screen quickly. A short video so Turn made tutorial videos during the pandemic. As many of you know, we used to do in-person trainings. I know I had the pleasure of doing one at Bay Area Legal in the past, and for some of our Contra Costa partners in the past. We, of course, haven't been able to do in-person trainings. So one of the things we've done is that we've, will I be able to share my screen? Natalie, any chance?
Yes, you should be able to. I did put the link in the chat though, if people would rather watch it.
Well, I'd like to just show, because there's the website is a little bit fun. So if I could just show just very quickly.
You should be able to.
Yeah, it's still telling me I can't share my screen.
Oh.
In any case, so we made these online video tutorials. They're really fantastic. Let me see if I can, sorry, you're gonna see my cat. Oh, actually, oh goodness, sorry. Let me just get to this really quick because I really want to show you. These are such a fantastic resource, and I'm so proud of these. And of course, now I'm having trouble getting back to Zoom to share this. Okay, let me just share this really quickly. So, what are you seeing? For some reason, it's showing me my slides.
No, I see now Vimeo. Yeah.
Vimeo, great,
Yeah.
fantastic. So thank you, Natalie, for putting that link in the chat. As you can see here, so there's lots of videos, but if you go to the videos entitled Heal, this is housing and energy action leadership videos, and we have created very short 3 to 7 minute long videos in most cases. The arrearage management plan, because it is a more complex program, some of the videos are a little bit longer, but they're all under 10 minutes. They tell you how to sign people up for medical baseline. they give an overview of energy justice in the state and its role in protecting housing and protecting people's health. The care and fair discount programs are included. And then here is the arrearage management plan. And so you can learn, you can get an overview of all of the programs, learn who is eligible, how to sign people up, frequently asked questions. And so I just encourage you all, if you have use for these videos, if you have clients who need support, the videos are geared toward an audience of community advocates and direct service providers. However, you know, customers themselves are welcome to access the videos if they just need support trying to figure out how to sign up for these programs. So please do disseminate as you see fit. And the slides included my information in case anyone, and I'll put it again in the chat, I'll put my email in the chat in case anyone has questions or you need, or, you know, you have any feedback on the videos. We're really happy to be able to provide this resource for folks.
Thank you so much, Gabriela. That was really useful information. I certainly learned something new today. And sorry that your time was a little short. We just always, you know, go a little bit later than we wanted to. But I think we are definitely going to share today's recording, PowerPoint slides, as well as the link to Turn's videos. So you will be all receiving our information. And in addition, we're going to send you a quick survey after today so that we could receive your input on our future meetings this year and next year. And in fact, you could actually fill out this form today if you want to. I think we could stop recording now, Natalie. I think that's good enough. Okay, so I think we're going to have some music while we just say goodbye